Okay, everyone, it's a couple of minutes past 2, so we'll get started so we don't take up too much of your day. Thanks for joining me this afternoon for today's webinar. Today we're going to be spending just 15 minutes on our digital forms feature of HotHealth. So today we're going to be going over why digital forms and why they're a smarter alternative for your practice or clinic. We're going to be going over why HotHealth forms, and then I'll also take you through a walkthrough of the forms part of HotHealth. Over the last 3 months, we've really noticed an increased not only interest in paperless forms, but also an uptake in technology such as HotHealth forms in terms of reducing physical touch points within a practice or clinic, but also allowing and facilitating telehealth for remote care. So it kind of comes down to those two points, that some patients or clients are actually not coming into the practice, so they can't actually fill out the physical form, but also it's helping out with making staff work more efficiently. As soon as there's a paper form or pen that needs to be touched, something else needs to be sanitized, and that takes away the time that administration staff can be spent doing other things. So I guess having them online is not just smarter because you're reducing some of the manual steps that need to be taken for information to get from a patient to your computer, but also it is reducing those physical touch points. So I think most people here are actually already part of the global health community today, so I won't go over who global health are. I will touch on HotHealth, as we have a couple of people that have not joined us for a HotHealth webinar before. So HotHealth is one of Global Health's core solutions. It's been around for a year to 18 months now, but over the past 6 months since the start of COVID-19, we really made a lot of improvements in the software more quickly and brought forward a few of our roadmap items to facilitate remote care. So things such as group video calls and this HotHealth forms as well. So we want to make sure that we can offer you guys the tools that you need to continue your services during this time. So HotHealth. HotHealth gives you a branded platforms for your digital forms. So in one spot, you can have your branding across all your forms. If you make a change to your color or your logo, that's reflected across all the URLs that have your forms on them. You can create as many forms as you need in HotHealth. So that could be for patient information. It could be for healthcare provider referrals, so medical related ones from healthcare providers. They could be screening forms, consent forms, patient satisfaction surveys, really any kind of form that you need to collect data from, you can do in HotHealth. So why HotHealth forms? It's, as I just said, branded, which is something that kind of continues that consistency across your touch points, especially when the patients aren't coming into your clinic themselves. It's device agnostic in terms of patients and clients can fill out the form on any device that has an internet browser. So that could be on their phone or computer or laptop. It's really easily integrated into your existing workflows. So because it's accessible via web browser and the forms are accessed via a URL, you can easily just input those URLs into workflows that you already have. So if you already send out an SMS to confirm an appointment or an email to do the same, you can just input this relevant form URL into that existing piece of communication. And so it already integrates with what you're doing there. It's Australian hosted, and we do have a local support team. And because of the other features we have in HotHealth, as your digital health requirements and tools scale up, the platform kind of supports that in terms of scaling as well. So from a features perspective within HotHealth, we do have some pre-existing templates that you can pick from to either use as is or build on or edit. And we will continue to build out that bank of templates as we go. If you do edit or create one from scratch, it's a drag and drop form builder, which I'll show you in a bit. You can get a little bit fancy and add conditions and validations in there as well. So if a patient answers yes to they've travelled overseas in the last 14 days, then ask the follow-up question, which country did they travel to? Or, if the patient answers yes to the fact that they're under 18, then show the guardian component of the form that might not be relevant to people already over the age of 18. And you can also do validations around, the form can't be submitted unless this type of data has been entered. It does have a digital signature box in there. There's notification emails from a perspective of, as a business, you can input what email address is notified of a form submission, and you can also add some rules in there as well. We've got referral net integration. So at a organization level, you can input a referral net endpoint, and then when you're creating a form, you can select whether that form, when it's completed or submitted by a patient, whether that is sent via referral net to your endpoint. If you don't want to send it via referral net, you can also save it as a PDF. You can view it in the web browser, or you can save the data as a CSV format, which is really good for satisfaction surveys or event RSVPs or something like that. And as I said before, it's URL access, so it's really easy to add into your existing workflow. On the topic of workflows, so one of the ones we see the most is, the form URL would be sent to a patient before a appointment occurs. The patient completes the form online. That form then can automatically be sent via referral net to your clinical or practice management system. Because it has the first name, last name, and date of birth fields in those, it can be kind of matched against an existing patient file really easily. Or if the system cannot find a match, it will prompt you to create a new client or patient. The appointment occurs, whether that's via telehealth or in person. And then because you can create as many forms as you need, you can then send a follow-up form, whether that's a satisfaction or patient collected outcomes or, really anything that you need to send, you can send after that. So I'm just going to jump into HotHealth now and kind of just show you that workflow. This is an example, we'll go COVID-19 because it's topical, a COVID-19 screening form. You can see, this is the branding of our demo site up here. So it's all branded within your branding. So enter in this information. There's a date of birth selector. You can have multi-select fields, or you can have choices as well. And then we can click submit. You can also add in things like if they did say that they had travelled overseas in the last 14 days, to send a separate email to another email address, just so there's another form of kind of communication that can happen before they come in for their appointment or whatever it might be. So that's how easy it is to fill out a form. From a form creation perspective, within the manager dashboard, to create forms, you just go down here to forms. Here we can see all the different forms that we've created for this organisation, how many total submissions there have been for that form as well. And if you want to create a new form, we just click on new form. As I said before, we do have some templates available, and we'll continue to kind of look at that. But for now, I'm going to choose the transfer of medical records template, and I go start new form. So because here I want it to be sent via referralnet, I do need to make sure that in that form I include first name, last name, and date of birth. If I did not want that to be sent to referralnet, for example, something like a patient satisfaction survey, you don't need to include the patient details there. Input the name of the form. This section here is where you input the email address that needs to be notified of any submissions. If you don't want to receive an email every time someone submits the form, you can leave that blank. Once we're in here, it's really easy to edit what is written. So in here, I can edit the actual content at the top of the form. We can save that. It's all drag and drop, so you can either drag new fields over, you can really easily delete them, and then you can also copy and paste fields if you need to kind of duplicate certain fields as you go. As I said before, you can add in data validation. So here we say this field's a required one. And then we've got the digital signing box here as well. You can add in consent items via things like a content box where you could paste in your consent text from your existing form, and then you can add a checkbox underneath that kind of says I consent to the above terms, and then they can have a signing box as well. You can also add a date box if you need to add a date next to when it was signed. Down here, as I said before, we've got rules. So if you had a new patient client form that needed to, maybe you have a few different services at your clinic, and when someone says they want to see the physio email address is notified of the form submission, as opposed to a osteopath or chiropractor. Once you're happy with the form, you can click create, and that creates the form URL. So that was prompting me, because I had ticked send to referralnet, it was prompting me that my last name box had not been correctly mapped in the back end. So it does try to tell you if something's not done correctly, it will prompt you to fix that. So I'm just going to untick send to referralnet for this one. So once it's created, this URL here is the one that you can send to your patients. You can attach that to your website, you can attach it in an email, you can put it in an SMS, you can create it a QR code that points to it if you do want to have something within the clinic. There are loads of different ways you can incorporate that into your workflow. I'm just going to show you, if I jump into one that has some form completions, down here, so if you are not sending it via referralnet, to get the data out of it here, we can see if the user that filled out the form was logged in, we can see who that user was. We can then view that form submission here. We can also save that as a PDF. And as you just saw, now that I've viewed that form, it's turned green. So it's an easy way to kind of keep track of who's seen what as well. So it was last viewed by myself because I was logged in. If that was another user, that would say their name. And you can also export it via CSV. If you have had it sent to referralnet, it will come through to your inbox and you'll be able to process that within your normal workflow for your clinical and practice management software. So that's the workflow in terms of filling out the form and then it being sent via referralnet as well. So in terms of pricing for HotHealth, for those that don't know, it is a subscription-based model, a monthly one. And then we have usage-based charges for video consults, online bookings, and also digital forms. Mastercare Plus customers of Global Health, they do get 25% off their HotHealth subscription. And then pricing can be found just on our pricing page, hothealth.com/pricing. So you can see here on the Pro plan, if you use up to 100 forms, it will cost you $30 for that month. And that works out to about 30 cents a form, which when you compare that to printing off a form and having someone fill it out and being able to read their handwriting, scanning it back in, it works out to be a pretty cost-effective way of collecting data and also improving your processes and digitizing some elements of your practice as well. So that's HotHealth forms. If you've got any questions, as I said, feel free to shoot me an email. We're up to 20 minutes now, so I won't take up any more of your time. And if there's anything else in HotHealth you want us to cover, please let us know and we'll look to cover that in July's webinars as well. So thanks everyone. Thanks for your time. Have a good afternoon and enjoy the rest of your week. For those that are in Victoria, stay safe as well. Thanks, guys.